My name is Dr. Sanjay Juneja. I'm a hematologist and medical oncologist, and I want to quickly talk to you about what is immune therapy. So the classic way we used to treat cancer is with chemotherapy. It was a generalized, what we call, poison, as you'll see in a previous video, and you try to poison the cells enough so that they die while preserving your good cells. Then something called targeted and immune therapy started coming on board, and that changed the whole game on how we treat cancer. Immune therapy came on board around 2015, and at first it came out in lung disease, but now it's rapidly showing signs of working in several tumor types. The way that immune therapy works is there's a PD-L1 or PD-1 stop sign, and this stop sign is expressed by cells to tell your body, hey, don't attack me, I'm good, I'm doing what I'm supposed to. Well, cancer cells can start showing that stop sign, and that's maybe how they escaped your body from being killed to begin with. Immune therapy goes in and it knocks that stop sign away, so all of a sudden your body can actually kill that cancer cell. It's very effective, sometimes by itself or with chemotherapy as well. The problem is, sometimes you can get too excited or hype and start attacking your own regular cells. So anything that had a stop sign, which are your regular cells, all of a sudden the stop sign might go down and your body starts attacking it. So while immune therapy is really effective in a lot of cancer types, it's also very tricky in the sense that when it causes side effects, it can be very subtle because it can attack anything from the head to toe. So if you have someone in urgent care comes in and says, oh, I have diarrhea, I have a new cough, shortness of breath, blurry vision, you would have treated it one way, but if you ask them, are you on immune therapy? That one way you would have treated it supportively and just managing the symptoms would only work for so long. What they really need is steroids to knock down that immune system so that it doesn't continue to attack it. Because when there is an immune therapy related side effect, things can get bad very quickly. Before too long, you're going to know somebody on immune therapy just because of how commonly it's being used. As these things evolve, it's going to be important for all of us as providers, as patients, and as the loved ones of the patients to be very attentive and think and realize, could this be related to immune therapy? It gets tricky and we're going to learn more as things go on, but that's one example of kind of an immune therapy, targeted therapy that we do, especially in stage 4 disease that was really difficult to treat before. And like I said, with targeted therapy as well. So with breast cancer, you always hear about triple negative or triple positive. 2 of them are hormone related, estrogen and progestin. And the third one is HER2. And that, before, was very bad. People that had HER2 positive in their tumors had a lot of difficulty. It was an aggressive breast cancer. Then we found something called Herceptin, and that targets that HER2 receptor, and suddenly the whole game changed on how we treated HER2 positive breast cancer. Another thing that's very exciting is there's a mutation called NTRK, NTRK. This is the first mutation that it doesn't matter which cancer you have, if you have this mutation, you can take this drug and it's like 80 to 85% effective. It's not a common mutation, but it's an idea of where we're going. Instead of chemotherapy and somebody needing to be sick when they're already advanced, we can just find mutations and target them. For that reason, it's always important to try and get a biopsy and see what mutations do you have, and do you have these targets that you can have, basically, that you can qualify for to attack. Mutations and targets are coming out so quickly that there are patients that have now lived for a year or 2 years with stage 4 disease that, boom, all of a sudden have a mutation we know about and now qualify for targeted therapy. Chemo's gone, targeted therapy on board. The more options you have, the better chance you have of having long-term survival with good quality of life.